Hello, everyone. My name is Maribel,
And I'm Megan.
and today we will be discussing on whether magnesium supplements are effective as a treatment for anxiety. So first, what is magnesium? Magnesium is a mineral that is involved in processes in our body, such as protein synthesis, and they are found in foods such as bananas, beans, and legumes, as well as in supplement forms such as magnesium oxide, citrate, and chloride. Deficiency is not pretty common among individuals, but if there is a deficiency, the signs would include nausea, fatigue, weakness, and loss of appetite.
What is anxiety? Anxiety is a response to stress that causes uneasiness and worry. Most individuals experience this on an occasional basis, but general anxiety disorder is an occurrence on a continuous, sometimes daily basis that interferes with the day-to-day life. And there are many different types of anxiety, and treatment for anxiety is usually psychotherapy and medications. And how magnesium would help manage anxiety is because magnesium maintains many bodily functions, specifically with the central nervous system. And so involvement in these processes shows that magnesium supplementation may play a role in improving mental illness and psychiatric diseases.
So our claim is that magnesium supplements do not effectively treat or reduce anxiety. And for our first support is that when we were doing our research, it was stated that based on a systematic review, there were inconclusive results for effectiveness of magnesium supplements. The inconclusive evidence was due to needing more long-term studies to show the long-term effects of magnesium supplementation in mild anxiety. And then for our support two, based on another systematic analysis review that was done, more research of magnesium monotherapy effectiveness on anxiety treatment is needed. The studies that were collected and researched showed that majority of the treatment that was given to patients who had anxiety were either in a form of multivitamin, having other supplements with vitamin B6, or even with herbal supplements. So it doesn't show the true effectiveness of just magnesium on its own being effective for anxiety treatment.
Our third support is that magnesium supplementation is ineffective in anxiety related to hormones. So, on a study that was conducted on postpartum women, they were given a magnesium supplement of 320 milligrams every day for 8 weeks. And they were able to complete different anxiety scales as well as blood tests. And in conclusion, taking the magnesium supplement for the 8 weeks did not help women at all with their postpartum anxiety symptoms. And then for our support four, it is inconclusive to whether or not a magnesium deficiency increases anxiety risks. So an evaluation was given on university students just a few years ago in 2017. And these students had no psychiatric disorders or past mental illnesses. And they were given dietary intake magnesium, and they were given a 24-hour recall to decipher which students were given enough magnesium in their diet and the ones that were not. And between the two groups of students, there was no difference in the anxiety levels. So, as a conclusion, there was really no inconclusive data that magnesium levels in the blood or within dietary intake give any significant difference in anxiety levels. So
So
as a whole, there is really no evidence that has been researched that shows that anxiety is helpful. I'm sorry, magnesium is helpful for anxiety, and magnesium supplementation is a treatment for anxiety.